My favorite foods are sharp cheddar cheese, pizza, and ice cream. What do they all have in common, besides being delicious? Yep, you guessed it. They all contain dairy products, which is why I would be really bummed out if I were ever diagnosed with lactose intolerance.
Lactose intolerance is the inability to metabolize a molecule called lactose, which is actually a type of a sugar. Some people are born with it, and some people acquire it as they get older. It also depends on what ethnic group you're part of. Almost 100% of Asians are lactose intolerant at some point in their life. In fact, an interesting fact is that more people in the world are lactose intolerant than who are not. But as you get older, the amount of lactase that you produce to metabolize lactose becomes less. So you can be born with it, but you can also acquire it as you get older.
In others, lactose intolerance may be the result of an injury to the small intestines, such as intestinal diseases like Crohn's disease or an infection like gastroenteritis. The symptoms of lactose intolerance, the bloating, the gas, the abdominal pain, stem not from the dairy products themselves, but from the intestine's inability to produce an enzyme called lactase. In a person without lactose intolerance, the cells of the small intestine produce this enzyme, lactase. Lactase then digests the sugar lactose into two carbohydrates called glucose and galactose, which are absorbed into the bloodstream. In patients with lactose intolerance, there are little to no lactase enzyme, which means the lactose moves through the digestive system undigested. As it moves, it produces gas that causes the symptoms associated with lactose intolerance. The gas produced is hydrogen. This byproduct allows physicians to diagnose lactose intolerance with a hydrogen breath test.
When you do that, you give the person 25 grams of lactose, and they drink it or they eat it overnight. Then they come in and you measure the production of the hydrogen that comes from the non-digestion of the lactose by measuring their breath. It's actually a 3 to 5 hour test. So most people don't like to do the whole test. They rather do it just by eliminating the milk product and seeing if the person gets better.
But for most patients, lactose intolerance is diagnosed based on a history of eating dairy and then having the abdominal symptoms. Once we know that lactose intolerance is the source of their pain, it's fairly simple to treat.
Usually, you kind of do it by a dietary history, and if you're going to do it by eliminating all milk products, you have to be very strict in the milk products that you eliminate. There's tablets that you swallow. You have to take it right at the same time that you take the milk, because the enzyme has to be there when the lactose is presented to the intestine. They vary in the amount of pills that you need for a given amount of lactose. Some people need 2 pills, some people need 4 pills, some people it doesn't work at all. It really depends upon how much lactose intolerance they actually have, how little enzyme. Some people have a little bit of enzyme, some people just have no enzyme at all. People who have a little bit of enzyme are probably a little bit more helped by the lactate pills than someone who makes no enzyme at all.
Immediately after a diagnosis, there's a bit of a learning curve to determine what is the maximum amount of lactose a patient can consume before having symptoms. Patients with severe lactose intolerance have to be very careful because lactose can be in things you wouldn't even think of. For example, certain medications like birth control pills or some antibiotics are coated in lactose. These patients also have to look at labels for words such as lactose containing or milk product containing or whey. Now, there are lactose pills available that can be taken before consuming dairy products to help stem symptoms. So if I ever develop lactose intolerance, I'm going to take those pills because I don't want to cross cheese off my grocery list. I'm Dr. Mike Rosen, and you're watching the eHealth Network. See you next time.